Hello, my name is Luigi Biel, student in Professor Jennifer Gunderman King's class for Foundations of Maternal and Child Health. Today, I'm here to discuss the case study analysis on the ongoing hunger crisis currently experienced in Venezuela. In summary, Venezuela, once the richest country in South America, is facing cataclysmic ruin due to poor mismanagement of the nation's leadership, causing crime, death, and malnourishment amongst the country's people. The current problem consists of an alarming percentage of children across Venezuela who are suffering from malnutrition as a consequence of economic and political crisis affecting the country. While precise figures are unavailable due to limited official health or nutrition data, non-official studies show that 54% of the Venezuelan children are nutritionally deficient. Figures reported by the Venezuelan Health Ministry reported that infant mortality rate was at 30.12% in 2016. Collaboration between the government and civil society organizations are required to assist in the public health crisis. The target population for this presentation is geared towards members of the Bill and Melinda Gates Foundation, with the overall program goal being that the foundation provide Venezuela with needed resources and influence other organizations to assist in public health efforts. Years of economic mismanagement and failing government system, Venezuela, once an oil-rich country, is facing record levels of child malnutrition as it experiences severe shortages of food, medical supplies, and other basic services. Dealing with a hyperinflation rate of nearly 14,000%, children are the most impacted as the majority of kids have resorted to violence in hopes of getting food. The Venezuelan government has tried to cover up the extent of the crisis by enforcing a near-total blackout on health statistics, but the media and foreign organizations are bringing the issue to light. Contributing factors attributing to the childhood malnutrition crisis have included a low birth weight in newborns due to inadequate antenatal care or maternal malnutrition, inadequate breastfeeding practices within the first 6 months of life for a newborn, followed by a lack of nutrient-dense complementary foods or micronutrient supplementation regime. Young children are being forced to abandon their families and homes to join criminal gangs or rummage through garbage for food. Using the socio-ecological model to identify connections and influences within the context of childhood malnutrition rates in Venezuela, community members at the individual level are helped by receiving maternal health education on the importance of consuming prenatal vitamins to ensure healthy pregnancies. A hindrance at the individual level would be that many of these medications can only be found on the black market, as there is a medication shortage of 85% in Venezuela, making it very difficult and expensive to get the suggested care during the pregnancy. Help in relation to the interpersonal level is included family members from outside of the country being able to send care packages to citizens in Venezuela. A hindrance within this level would include the massive limitations imposed by shipping companies that one can send to Venezuelan residents. Help associated to the organizational level includes organizations such as Caritas Venezuela, which operates more than 400 communal soup kitchens across the country to combat childhood malnutrition rates. Other organizations haven't been able to help in Venezuela as the federal government does not want foreign help. This can be considered a hindrance to the organizational level. At the community level, help is provided through the Seed Multiplication and Distribution Project, which was founded by a group of 20 local farmers. This was done in an effort to create access to nutritious and well-balanced foods for youth in the area. A hindrance at the community level is that there aren't enough initiatives available that are willing to partake in these activities. Help at the policy level included the government raising the minimum wage in March 2018 with the inclusion of a monthly food ticket to help offset expenses associated with food costs. However, these very same wage increases can be seen as a negative factor, as this has been the 13th time that the president of Venezuela has done so, exacerbating hyperinflation rates in Venezuela. The first proposed intervention would address maternal health. Beginning in the third trimester and utilizing the World Health Organization's recommendations, the mother would be counseled on the health benefits associated with exclusive breastfeeding for the first 6 months of life, and later promote dietary diversity through complementary feeding from 6 months to 23 months. The second intervention would promote intake of vitamin and micronutrient supplements through social health marketing campaigns to avoid nutritional deficiencies in young children. The third intervention would include training and supporting community health workers to carry out screening services to assess and treat children if diagnosed with severe acute malnutrition. Lastly, the fourth intervention would be to form partnerships with private organizations to assist in the acquisition of money, food, and dietary supplements so that they can be given to health program participants via food packages. Evaluation of the program will take place amongst community stakeholders to gain valuable insights on barriers faced by the community after the health intervention has completed. We would then analyze and make adjustments if needed to gain additional support from community members. The first intervention would be evaluated by measuring the birth weight of babies whose mothers underwent the health education program for maternal health. Weight data would then be compared with non-participating mothers to see if there were any significant differences to the newborn's weight. The intervention would be considered a success if participants who underwent the maternal health program had heavier babies when compared to those that did not undergo the program. The second intervention would look at the relationship that vitamin and micronutrient supplementation has on a participant's weight. Prior to the commencement of the intervention, the child's weight would be documented to act as a baseline value. The child would then be given daily supplements with social marketing campaigns to act as a reinforcement for the next 90 days, and then they would be reweighed at the end of those 90 days to log any differences in weight. The intervention would be considered a success if no weight was lost, in addition to the participant having gained weight. The third intervention would be evaluated through the use of health indicators. Prior to the intervention, the number of children that are diagnosed with severe acute malnutrition would be documented to act as a baseline value. After a period of 6 months, community health workers would perform another analysis of children diagnosed with severe acute malnutrition and compare data points to determine if there is any change. The intervention would be considered a success if there is a less prevalence on the second analysis when compared to the baseline. The fourth intervention would be evaluated through the use of a mixed methods approach. Quantifiable data would be obtained through the health program analysis of weight gains amongst family members. Qualitative data would be captured through a survey that captures satisfaction levels of the items being dispensed amongst the food care packages. The health intervention would be considered a success if the family gains weight. Challenges or barriers that pose a threat to the success of the health program include the Venezuelan government blocking foreign organizations from providing food and healthcare supply aid due to fear of political espionage. Healthcare in Venezuela is nearly non-existent now due to a lack of healthcare professionals, medications, and supplies. This means that families with children suffering from severe acute malnutrition may not see them survive, driving mortality rates higher. Political unrest and a looming economic disaster has turned shopping for basic goods and services into a nightmare. Hyperinflated prices and a lack of basic necessities have turned community members into a shadow of what they once were. Lastly, due to economic woes in the country, it will be very difficult to maintain locally based program partners, as they also would be facing the same economic issues that community members are. This would mean that the health program would need to find an international program partner that is willing to maintain a long-standing partnership to benefit the community. In conclusion, as the world watches Venezuela enter the worst period of political strife and turmoil it has ever faced, foreign aid and humanitarian health relief efforts are needed. The Venezuelan people who remain in the country are bearing the brunt of economic and political chaos, including an increasing inability to put food on the table while children go hungry. While not a long-term solution, aid from the international community can act as a temporary remedy for the problem. Significant changes in national governance is required to begin rectifying all of the wrongs done to the people of the country, and only time can tell if the Venezuelan people can move forward from these dark times. Ensuring that children's health needs are addressed is an important part of moving the country forward, and I hope that this health program is an important step in the right direction. Furthermore, training and supporting local community health workers to monitor nutrition problems will also benefit the country moving forward. Lastly, having expectant mothers receive the proper antenatal care guidelines posed by the World Health Organization will lead to reductions in reported rates of childhood malnutrition in Venezuela. Thank you for listening. Have a nice day.